Good afternoon, everyone. Today in this live session, we are going to discuss about a very common question that I get asked in my clinic a lot, which is about dark circles. Uh, People want to know why they are having dark circles, what is the right treatment for dark circle. There are a lot of myths when it comes to about dark circles and the proper treatment for that, and a lot of people are there who are wasting a lot of money on expensive eye creams or treatments that are not suitable for their kind of dark circles. So the biggest myth that I would want to put it aside right away is that improper sleep or poor sleep might not be the reason of your dark circles, because someone can sleep for 8 hours, can they can drink plenty of water, use an expensive eye cream, but still have dark circles. So that's why it's very important to understand. Today in this live session, I am going to make you all understand, if you have dark circles, what is the reason for your dark circles. So we have mainly 4-5 important causes of under eye pigmentation. We can call it as periorbital hyperpigmentation, or in common terms, dark circles. So mainly I'm going to use under eye pigmentation or dark circles for the ease of understanding in this live session. These are the terms that I'm going to use. So the most common cause is the pigmentation kind of dark circles. And how do you know that? You stretch your under eye skin, and if you feel that if your under eye dark circles remain same, then most likely it's because of the excess pigmentation deposited in your under eye skin. But if that dark circles improves, then that could be that could be vascular type of dark circles, which is that your overlying under eye skin is very thin. By the way, all of you can ask me any questions that you want to ask about under eye pigmentation, dark circles, the treatments that you have been thinking about getting. Just keep on commenting in the comment section, and I will answer it immediately. So yeah, coming back to the stretch test that we do to know what could be the reason for the dark circle. So if you stretch your under eye skin like this and you feel that the pigmentation has improved, then it could be because of the vascular kind of dark circle, which is that your overlying skin is very thin and the blood vessels are visible. So when you stretch, it sort of camouflages, it sort of makes it better. But if it because of the pigmentation, it will not improve. Then another very common kind of dark circles that we have is because of the teardrop deformity, or also because of the hollowness under eye. So these are the hollow kind of dark circles, and no amount of under eye cream or treatments are going to work on these type of dark circles, because they are because of the shadow that forms under your eyes, because the natural shape of your eye socket is such that there is a lot of hollowness under the eyes, and the light reflects in a way that you get that dark shadow. So the best treatment for that is what we do at Kolors, and you can discuss it with your doctor, is we do a HA filler, hyaluronic acid based fillers in the under eye, which really helps in improving those hollowness. And a lot of myth around under eye fillers as well, that you need to get them done again like every 6 months. But in my practice, I have seen that they last much more longer than that, and usually you never need to go back to the you almost never need to go back to the original amount that you got injected. Suppose if it's your first time, we are treating hollowness under your eyes, and I am injecting 0.75 ml in each eye. First of all, it lasts way longer, and then even after 2-3 years you feel that okay, I need to get it done again. We might just end up doing 0.25 or 0.5 ml, so in much lesser quantity. A lot of people are giving me a wave, so hi to everyone. We are talking about under eye pigmentation, called dark circles in layman terms. Any of you have any question regarding that, please ask in the comment section. I'm here to clear all your confusion, discuss all the myths. So I think a very common myth that people have when it comes to dark circles is that we have been told a lot that you're not sleeping properly, that's why you have dark circles, or you're not drinking proper water, that's why you're not drinking enough water, that's why you have dark circles, or you need to massage and do icing and all of that. Actually, these things are very temporary, they do not do much. Like, you can have as much water as you want to have, but if you have pigmentation or if you have hollowness under your eyes, it's never gonna go away. And one can sleep, like, okay, not sleeping properly can definitely worsen your under eye pigmentation. It can worsen if you are someone who's prone to get under eye puffiness or the under eye bags. But you can sleep, but there are many people who sleep a lot. Yes, exactly. Someone asked, can dehydration make dark circle worse? It can make them worse, but how many people are actually dehydrated? You need to be very severely dehydrated. And dehydration, what it does is it makes your skin very wrinkly, it makes your skin very dry. So overall skin would be very dry, and the skin under your eye is very thin, it's very sensitive. So when it becomes dry, you can actually pinch and see it's so rough, and anything which is rough, dehydrated, is going to look darker. But it's most of the time the patients that we see in the clinic, not drinking enough water is not the main cause of their dark circles, and it's not something that is going to solve it as well. The usually people have more than 2-3 causes. Like, someone will come, most commonly they will have under eye pigmentation, they will also have some age related hollowness or tear trough deformity, as we call it in technical terms, and they will have thinning of the skin over there. So in that term, in that scenario, my treatment approach would also be combining a few treatments for them. So a go-to treatment would be to go for some amazing under eye peels. And these are chemical peels that we do in the clinic, very good improvement in pigmentation especially, and they are also very hydrating, they improve the skin quality. Another important treatment that we do to improve skin quality is 2 injectable treatments that I like doing. One is under eye PRP, another is under eye polynucleotide. So under eye PRP, under eye polynucleotide are very much in demand these days because people are focusing on improving the skin quality. So the dark circles or the thinning of the skin over age can really be improved with regular sessions of under eye polynucleotides as or under eye PRP. And that helps in also improving vascular kind of pigmentation as well. And then another treatment is we can do some lasers which target the melanin. So we can do pico laser by, obviously around the eye is a very sensitive area, and it's a very area that we have to be careful about. So like properly shielding the eye, making patients wear eye shield, and then we can do laser in the lower eyelid mainly. That also helps in improving the under eye pigmentation. Another treatment that we commonly do is we have ICEL, which is like a 3-4 step proper treatment regime for under eye. That includes deep hydration for the eyelid and the under eye, lower eyelid skin. And it includes some exfoliating, brightening serum application along with microneedling. Microneedling is also, it has very specific type of derma rollers specifically designed for under eye skin. And these are they help in again improving the skin quality. Microneedling will give a stimulus to your skin over there to make more collagen, for make it little improve the quality and make the skin a little thicker. And this brightening serums, these, and it's followed by a nice massage. So the skin will be deeply hydrated, it will start looking brighter with subsequent sessions, and it will also improve dermal thickening and will make the skin, the under eye skin, look much firmer. Also decrease the appearance of wrinkles that we start getting. So that is also one of my very favorite treatment for under eye, is that we do at Kolors, which is called eye and chemical peels, it depends on different type. We do arginine peels, we do lactic acid peel, arginine and lactic acid peels. There are some other phenol, different kind of peels that we have for under eye pigmentation, depending on the person, the how's the skin is. Now, another very common cause that I want to touch here when it comes to under eye dark circles are the people who have very dry and eczema prone skin, specifically people who have atopic dermatitis. So what they do is atopic dermatitis people, and also people who have eye allergies. So they tend to rub their eyes a lot and they have dry skin. So dry skin along with constant rubbing of that skin leads to a lot of dark circles. These are also called allergic shiners. So for those people specifically, going directly for like chemical peels or stronger treatments, it's not a good idea. First, we work on improving the skin quality. So for them, deep hydration, under eye PRP, these are the kind of the treatments, and obviously some soothing ceramide based moisturizer and deeply hydrating under eye creams along with these treatments are going to do wonders for their. And then whatever the residual pigmentation, once we have improved the hydration of the skin, then we work on the pigmentation with the help of either very mild gentle chemical peels, or it could be certain lasers, or as I said, with the ISL. Now, if any of you have any question, any doubt regarding these treatments, you can ask us, or you can come for a consultation at Kolors, and we can have a proper look at what kind of issue you're having when it comes to under eye pigmentation. A proper consultation can, and then followed by making a plan for you. So usually it's never one cause. Whenever a patient comes to me or to any other branch in Kolors, we assess what are the causes, and usually there would be 2-3 causes. So that's why our treatment plan would also include 2-3 kind of treatments that we do, mostly spaced at around 10 to 15 days. So every 10 to 15 days we would call patient and we'll do different sort of treatments for their under eye. And it takes this, again, the skin is very thin when it comes to your under eye, and the skin over your neck is very thin. So we have to be gentle while treating it, and we go slowly and steady. So it takes time. You don't expect a lot just after one session. It takes time. The only treatment that gives you instant result and that instant gratification and really opens up your eyes are the under eye fillers. And a lot of people are very scared, but these under eye treatments done by an experienced dermatologist who's properly trained and have done a lot of under eye fillers are amazing. They will give you on table results, and they will really open your eyes. They will improve the pigmentation, and someone who actually has those very typical genetic or under eye hollowness they really change the way they look, and again, very very gratifying. So we love doing that at Kolors. If any of you is interested, please take a proper consultation. There is a lot of myth around a lot of treatments when it on the internet, so don't go by what you see at the internet. Come to Kolors, take a proper consultation, and then decide what you want to go for. So if any doubt so far about any of the treatment, do let me know. You can ask in the comments. I'm here to answer all of your questions. Sometimes also, especially when it comes to women, nutritional deficiencies, especially low iron and low vitamin B12, can be a very important cause of your overall face and your skin looking very dull. So that is also something that we always keep in. Like I always ask them to get the vitamin B12, vitamin D3, and iron levels checked. I think that's very important. You can get that done on your own as well. So, just summing up the session, a few things, a few important causes of dark circles for the people who have just joined. Dark circles can be, there could be four important causes. It's not just if someone has dark circles, it's because of the same reason, and same treatment would be beneficial for them. One, it could be pigmented type of dark circles wherein your under eye skin is just more, has more pigmentation. Second, it could be vascular type, with which is when we are aging, our skin becomes thin, and if someone has a lot of blood vessels underneath, they starts to be more visible, and you have that bluish kind of under eye pigmentation. Another very important cause, especially in India, because we have a lot of diabetes, and that insulin resistance starts showing up, and it starts showing in the form of acanthosis nigricans, which is thickening and darkening of your skin. You can see it over the forehead, under the eyes, around the neck. So that insulin resistance in diabetes is also one of the very common reasons of having very little thickened and very dark under eye skin. Another cause is hollowness or genetic. Someone like even the kids who are 16-year-old, 17-year-old have dark circles. Those are not, has nothing to do with aging or poor sleep or nutritional deficiency. It's just the normal shape of their under eye, the shape of the eye socket, which they have little deep setted eyes. So the area under their eyes looks very hollow, and the shadow forms, and it makes uh, make them appear darker than the rest of the face. So for that, again, I said that under eye filler is a very good treatment option to be considered after discussing with the right dermatologist and who's experienced in injecting. That usually most common causes of dark circles. Another is the one I have discussed is people who have atopic dermatitis or eczema prone skin, extremely dry sensitive skin. Their skin would be dry, and they would tend to rub it a lot, because along with dry skin and eczema, they would also have a lot of eye allergies. So someone who gets a lot of sinusitis or all of that, so they tend to rub their eyes a lot, and that also becomes a very prominent cause of under eye pigmentation. So these are few of the common causes. According to that, when we assess what is the cause, that is when we make a proper plan for you. Off topic, but someone has asked which is the best treatment for weight loss, full body. I think they want to ask cryo or oil massage. The best treatment for weight loss, obviously, the first and best would be to be in calorie deficit and eating the right nutrition. Another, cryolipolysis is a very good treatment, but it focuses on like where you have that pocket of fat. And Evolvex is a very good option that we have at Colors, which really works well in melting and forming your skin. Even after, if you're losing weight, your skin tends to be very lax. So for that as well, massages are very good for a proper lymphatic solution, lymphatic drainage. So I think that's about it. Not a lot of people seems to have queries about under eye pigmentation. I hope the session was useful for you people, and but I would again say, rather than self treating yourself, it's always better to go take a proper consultation. discuss it with your dermatologist and then decide the right treatment plan. Because when you look at someone, the first you notice their eyes, the under eye area, so it's a very it's a very rewarding thing to get it done. And it's also very gratifying for us as well to treat someone's under eye hyperpigmentation. So that's about it. I'm going to close this live session. I hope it was useful for you people.